Start vaccinating against yellow fever now. That's the other message from the World Health Organization to countries in Eastern and Central Africa. No new cases of yellow fever were reported in Angola over the past 6 weeks, but this week, groups including Doctors Without Borders started a massive emergency vaccination campaign in the Democratic Republic of Congo. Now, this project is trying to blunt the largest yellow fever outbreak in decades. The group hopes to vaccinate 10.5 million people over the next couple of weeks. And for more on the concerns of yellow fever, I'm joined now by Kathryn Jacobsen. She's a professor of epidemiology at George Mason University. Kathryn, welcome back to the broadcast.
Thanks, I'm glad to be here.
How do we know if it's under control right now? We haven't had any new outbreaks in 6 weeks.
Well, there haven't been cases in Angola. There have been some cases over in the Democratic Republic of the Congo. And we're really worried about border transmission. It's a rather porous border, rather rural. So there could be pockets of infection happening in DRC that we aren't aware of yet. That's why there's the push to vaccinate. We don't think that this outbreak is over yet, and getting ahead of it through vaccination is the way to keep it from getting bigger.
How did it spring up again? How did we get into this situation?
Well, yellow fever is spread by the same mosquitoes that spread Zika virus. And so that's a very common mosquito across Africa and a lot of Asia and the Americas. It can be prevented, yellow fever, through vaccination. When there is a vaccine shortage, routine vaccination isn't happening. That leaves a lot of children vulnerable to the infection. And when there are a lot of susceptible individuals around, an outbreak will happen.
Why is there, in fact, a vaccine shortage right now?
Well, the big problem we have right now is that we don't tend to stockpile yellow fever vaccine or other vaccines used for epidemics that primarily affect low-income countries when there's not also a demand in other parts of the world. We routinely vaccinate for measles everywhere in the world, so we generally have good stocks of that. But we only routinely vaccinate for yellow fever after there's already a problem, so we don't tend to have millions and millions of doses sitting around waiting to be used.
Do we need to invest more? Do countries need to be investing more in this vaccine?
We do, and that's part of what the WHO is saying about setting up an African fund that would be able to, by pooling resources across countries, stockpile the preventive health tools that we need. Individual countries in Africa don't really have the health budgets to prepare for every possible outbreak, but if we pool our resources, that makes it a lot more possible to respond to these sorts of urgent situations.
How do you control it right now and keep it from spreading to other countries?
Right now, what we're doing is, because there is a vaccine shortage, using just a 20% dose instead of a full dose of vaccine to try to spread the vaccine as far as we can get it. A few months from now, more doses of vaccine will be available. We will need to continue vaccinating in Angola and DRC and in any other countries where it's spread.
So it was the 18th and 19th century, the last time that there was this, severe outbreak of yellow fever. Who's to say that we won't end up in this situation again? We've got to produce the vaccine pretty fast.
We do. We do have preventive tools now that we didn't have back 100 years ago. Yellow fever was one of the big challenges encountered when the Panama Canal was being built. And I think many of us thought, well, those days are past now that we have the vaccine, but we have to be able to distribute the vaccine to the people who need it to prevent it from becoming more widespread.
All righty. Well, Kathryn Jacobsen, thank you so much. We appreciate it as always.